Hey, I'm Dr. Perry from Farmington Family Dental. I get a lot of questions about dental bonding. What is it and why is it done? So I'm here to answer some of your questions today. Dental bonding is where we bond a tooth-colored filling or filling material on over the front or inside of a tooth to repair it or make it look better. Okay, so dental bonding is recommended in a couple of different situations. So one of the most common is when you have a cavity, it needs to be filled. Sometimes we use it on the front of teeth to make teeth look a different shape or a different color or just look better. In those cases, sometimes people will have antibiotic stains, coffee or tobacco stains they want to get rid of, or just make a tooth look a different shape, look a little bit bigger. Sometimes people are born with smaller or misshapen teeth that can be redone. Dental bonding is a very conservative way of repairing and fixing things. It also doesn't include some of the problems that we see with metal restorations or metal fixes in that teeth split or break over time, or you get that metal inside the rest of your body. Bonded teeth can look anywhere from okay to amazing, depending on how they're done, what materials are used, and what we start out with before we start working. Okay, so sometimes people ask me bonding or veneers, which one should I be doing? It really depends on what's going on in your individual situation. So for example, sometimes people want to whiten their teeth, and that's their main objective. They just want them to look white. Well, if they're starting really, really dark, they need a material that's able to whiten and block that dark underlying color from the tooth, block it completely. Usually veneers are what we would choose in that case. Or another example, sometimes people are young, and they just need something, a chip or a fracture fixed in a tooth. Well, bonding is a pretty quick and simple way to do that. And it allows us to see, is this going to be a long-lasting restoration? Or should we move on to something that's a little bit stronger than the bonding material is like the veneer? But usually we start more conservative wherever possible. Oh, so during a dental procedure, sometimes people ask, what do we do for a bonding procedure? Typically, we're removing decay. Once the decay is removed and cleaned out, then we're back filling in that hole that's made to remove the decay. If we're doing bonding for cosmetic reasons, we're really not taking much away from the tooth or anything at all. Most of what we're doing is preparing the surface of the tooth to receive that bonding. So typically we'll do a good clean on things, put our bonding agent on there, and most of the remaining appointment is sculpting and fashioning that to make it look good, and not only look good, but lifelike, which is probably the hardest thing to do in dentistry, but is so fulfilling when we nail it. Oh, gosh, is dental bonding painful? No. Typically, the most you experience during a procedure like that is pushing around the gums. Sometimes that's a little bit sore afterwards, but usually not even that. That dramatic change that can be done with that bonding, it looks phenomenal, it works great, and I don't remember the last time I had somebody report pain afterwards. Okay, so home care after bonding. Can you brush them? Can you floss them? Absolutely. You probably remember back in the olden days when we put metal fillings in, the dentist would tell you don't eat anything for like an hour or two afterwards. Dental bonding is not the same thing. It's a different type of material. And the material we use for dental bonding is set. The moment you're leaving the chair, you are ready to eat. You're ready to do whatever you'd like to do with that filling, except for chewing nails and things like that. Don't do that. But it's ready to go before you've even left the dental office. Awesome. So special instructions for caring for bonded teeth. My only special instruction I have is watch out for things that can stain bonding. So anytime we bond something to another surface, we end up with a little interface, that little gap in between, kind of like the gap in between two tiles, or the gap where the carpet's glued together. Usually you can't see it, but sometimes you can. With bonding, it's no different. That gap can stain. Some of the most common things that stain bonding, coffee, tobacco products. Even when the bonding is done perfectly, that can be the end result. Sometimes I see people come in and we refresh that bonding. You can change that. You can remove that staining. It's just additional maintenance that needs to be done on something like that. So if at all possible, to prolong the life of your bonding, if you stay away from those things, that'll work great for you. Coffee, tea, tobacco, red wines are probably the most common staining agents that we have. Lifespan. Let's talk the nitty gritty here. How long does this last when I have dental bonding done? I'm going to start out with it depends. It really depends on what you started with and what we were trying to accomplish. How big is it? Things like that. On the bottom end, when we do like a big filling in a tooth, I don't do these very often because they just don't work. Lifespan is anywhere from 3 to 5 years. That's crap. We don't like that. When bonding is done in an appropriate situation, I usually see years of serviceable life out of it. When it's done in an aesthetic location or on the incisal edge of teeth up in the front, those can be shorter depending on how the teeth are used. For example, if you like clipping your nails with your front teeth, it's not going to last. You wouldn't be a great candidate for that type of procedure. But in the absence of all of those habits and all of those things that can break them, they can last years. I think the longest I've seen in my career is about 35 years. Pretty good long lifespan. That is rivaling or even superior to the average length of a crown. Pretty good. Bonding is a great tool and could do a good long-lasting fix in a lot of situations. When you come in to see me, I'll talk to you about that. If you ask me, okay, how long is this going to last? I'll give you the best estimate I have. Awesome. So sometimes people ask, does insurance cover this? Do they cover bonding? When it's for an aesthetic reason, they're in a habit of rejecting it, not because they don't agree that it needs to be done, but because they're trying to get out of paying something, which I guess I understand. They're accountants at their heart. All that said, when there's any amount of decay or pathology present, typically I see accepting that bonding procedure. When we use like veneers or some other procedure like that to cover or take care of decay, sometimes they do, sometimes they don't. I'm happy to work with you. Come on in. I'll let you talk with our financial coordinator and they can narrow down, okay, what are we expecting from the insurance company as best as we can understand. Anytime we do that, by the way, it's an estimate. Insurance can say they're going to do one thing and then don't do the complete opposite when it comes down to it. All that said, we will be prepared for any situation that happens on that. We'll get you taken care of and happy with your end result. At the end of the day, when bonding is done for cosmetic reasons, there are some compelling reasons to do it. Most people just want to smile again. They want to feel like they can talk without having to worry about, oh, is there something in my teeth? Or people looking at that and be like, oh, is there a stain on your tooth? Yeah, it's been there for 20 years. You never noticed before? It gets frustrating. Give us a call. Come on in. Let's take a look and see what we can do to get you fixed up. Okay, so I hope those questions that I answered were very helpful for you. If you have anything else or if you want to come in and talk about this, give me a call at Farmington Family Dental. That's 573-756-5760. Give us a call. We'll be happy to help. Thank you.